Hi there, everyone. How you doing? Jeff C here. Saturday, October the 4th. Have you got enough of the Ebola fear porn yet? I want to show you something here. A listener sent me this. I can't remember who did, and I apologize that I can't find your message. Got it last night, but want you to listen in here. This is from the Texas Health Presbyterian Hospital. This is, of course, the hospital that admitted the first American ever to be diagnosed with Ebola on American soil. And I want you to listen in because, okay, we've done this so many times on this channel. They always do a drill. They always have plans in advance when they carry these hoaxes out. It's without doubt, right? They've always, and they often say, I mean, we've heard it time and time again, we prepared for this exact scenario, and go to the Lax Dummy or even Sandy Hook, where Governor Malloy said that we were warned that something like this might play out, right, the day of the massacre. They always do this. There's always these slip of the tongue sort of thing, and maybe they just figure it's not suspicious at all. But I want you to listen in here really closely what this Dr. Edward Goodman, the epidemiologist from the Presbyterian Hospital in Dallas, has to say about how they had just prepared in time for this. Listen to this. You can't make this shit up.
Our third speaker is Dr. Edward Goodman, the hospital epidemiologist with the Texas Health Presbyterian Hospital, Dallas. Dr. Goodman.
Thank you. Thank you to Dr. Frieden, Dr. Leahy, the CDC. I want to correct one statement that may have been misinterpreted by Dr. Frieden when he commented on the air we breathe. Ebola is not transmitted by the air. It is not an airborne infection. Texas Health Dallas is a large community hospital with a robust infection control system that works in close cooperation with the Dallas County Health Department, the Centers for Disease Control, as well as other epidemiologists within the system and in the community. We have had a plan in place for some time now in the event of a patient presenting with possible Ebola. Ironically enough, in the week before this patient presented, we had a meeting of all the stakeholders that might be involved in the care of such a patient. And because of that, we were well prepared to deal with this crisis. Infection control system that works in close cooperation with the Dallas County Health Department, the Centers for Disease Control, as well as other epidemiologists within the system and in the community. We have had a plan in place for some time now in the event of a patient presenting with possible Ebola. Ironically enough, in the week before this patient presented, we had a meeting of all the stakeholders that might be involved in the care of such a patient. And because of that, we were well prepared to deal with this crisis.
How many times have we heard that before, folks? How many times? I don't even know. Right? This guy working with the CDC, right? They're all prepared. They've been preparing for this for a long time, and they just had a big meeting with all the stakeholders that would be involved just days before the first patient just happens to walk through their door. You can't make this shit up, okay? If you believe this shit, you are as dumb can be. I mean, there's nothing I can do for you. This is fucking bullshit. They're bad liars. I mean, they get these guys up and maybe they don't read the script. Maybe they figure there's nothing to hide. I don't know what the hell they figured, but they just told you basically that they had planned this whole thing out. And this is the way it goes with every single one of these false flags, hoaxes. There's always a drill. There's always preparation just before, just by coincidence, out of all the hospitals. Right? Just happens to be that one, the Presbyterian Hospital in Dallas. You can't make this shit up. It's just fucking nuts. Thanks for listening. Leave your comments below.